Communication disorders in a multicultural world. What are multiculturalism and cultural competence? Multicultural is a society characterized by a diversity of cultures with varieties of religion, language, customs, traditions, and values. Cultural competence is the ability of service providers to recognize, honor, and respect the beliefs, interaction styles, and behaviors of individuals of the families they serve. Communication difference versus disorder. Differences are a communication behavior that is culturally and linguistically appropriate for the client's community. Ethnocentrism, a view that members of one's own culture do things the right way and members of other cultures do things in ways that are unnatural and inferior. Cultural relativism, other ways of doing things is equally valid. Stereotype, fixed, oversimplified image of members of a community. Cultural tendencies, patterns of behavior and values that are commonly observed among members of a culture, but the term recognizes the great heterogeneity and diversity within each culture. African American cultural and linguistic variables. African American English, AAE, dialect of Standard American English. Rule governs semantic linguistic system. Some examples of characteristics of AAE morphology and syntax are in the table. The omission of possession or noun. That's the woman's car. Utterances, that the woman car. Lack of person, number, agreement in past tense. They are having fun. They is having fun. Omission of past tense endings. He lived in California. He live in California. The form be used as the main verb. Today she is working. Today she be working. Examples of characteristics of AAE articulation and phonology. Code switching involves different linguistic styles for different situations. For example, one university professor pointed out that at work she uses Standard American English to communicate with colleagues and students. When she gets home, she uses AAE with her family. Assessments, most standards assessments are biased against AA speaker. Diagnostic evaluation of language variations, DELV, was created to use with AA speakers. Optimal to use DELV, language samples, and other non-biased measures when assessing students. AA children tend to be referred to as special education. Therapy. Utilize the support of family, church, and community. Make therapy for children warm, interactive, with opportunities for physical movement. Pronounce names correctly and use titles and last names for adult clients. Hispanic cultural and linguistic variabilities. Hispanic and Latino are used interchangeably as an umbrella term that encompasses the many cultures whose root language is Spanish. Hispanic families have a relaxed attitude towards child rearing, not pushing early independence but family interdependence. Hispanic children tend to achieve expected developmental milestones later than mainstream standards, but important not to misjudge Hispanic children as delayed. Hispanic families have a great respect for educational institutes and tend to keep their distance, leaving the decisions up to the teachers. It is important to support families and attempt to involve parents and reassure them that their input is desired and valued. Some variabilities. Alright, Asian cultural and linguistic variables. Chinese make up the largest proportion of Asians coming to the U.S. Major religions include Buddhism, Taoism, Confucianism. Many Asians speak several languages. Interdependence between family members is encouraged. Many Asians view disabilities in adults and children as a result of wrongdoing on their part of the individual's ancestors or both. Parents may feel guilt or shame. If a neurological event occurs, stroke, head injury, family may believe it's karma for wrong action and reject intervention. Asian children are taught to be seen, not heard, and may be silent out of respect. Asians value harmony and avoid confrontation. They may say what they think even you want to hear, even if they themselves do not believe it. Some of the variables here. How should culturally and linguistically diverse CDL children with communication disorders be assessed and treated? English learners, ELL, tend to be over-referred to special education and are placed in speech and language programs and other special education classes because they struggle in school and are not successfully accommodated. They speak little or no English and schools won't accommodate them. Public schools are taught in English only with little support from ELLs. ELLs come from environments and cultural backgrounds very different from typical middle-class students. They lack familiarity with English, and environmental mismatch issues sets them up for poor school performance and underachievement. Difficulty with English and classwork taught in English is not grounds for a diagnosis of a language disorder. Children must show difficulties or delays in their first language as well as in English to have an English disorder. Bilingualism typical process. Simultaneous bilingual acquisition occurs when two languages are acquired simultaneously from infancy or shortly thereafter. Sequential bilingual acquisition learns or are exposed to the first language during infancy and into the second part of the later point. Children learn a second language manifest certain behaviors. Errors of transfer. Errors in the second language caused by the influence of the first language. Silent period. Little or no talking in second language and sometimes silent in their first language as well. Language loss. With respect to the first language as the second language becomes more dominant. Non-biased assessments. When assessing ELLs for possible communication disorders, it is critical to have testing in their first language as well as in English. Individuals with Disabilities Education Improvement Act, IDEA 2004, testing and other evaluation methods are administered into the student's native language or mode of communication unless it's clearly not feasible to do so. Evaluation materials must be reliable and valid for the populations they are used for. Many standardized assessments are biased and inappropriate for ELLs. Informal, non-standardized assessment, case history, questionnaires, observations are recommended types of assessment. Valid methods of assessment. Dynamic assessment. Students is evaluated over time in a teach, test, and reteach format. Evaluate students' ability to learn when provided with instruction. Information processing. Research suggests that children with deficits in their information processing skills may have underlying language disorder. It's hard for these children to repeat back sentence, lists of digits, and nonsense words. Intervention for ELL students. If an ELL student has a true language disorder that is not the result of environmental issues, second language acquisition, or bilingual development, then they have a language disorder and intervention is needed. A language disorder affects the student's ability to learn any language. Research supports the idea that intervention can occur in both English and in first language. SLP should work with bilingual paraprofessionals or family members to help provide bilingual therapy. Therapy should be tied to curriculum and work to increase their vocabulary. Therapy methods and materials need to be culturally appropriate for that individual student. Intervention for adults. SLPs must evaluate patients' comorbid status and circumstances. What languages did the patient speak? What are the patient's skills in the first language and English after the neurological insults? What is the patient's premorbid education level? What are the patient's interests and goals in communication? SLPs need to understand how family values rehabilitation towards independence.